Poor sleep commonly causes a rise in a chemical called catecholamines and cortisol. These are the two chemicals which is released from the body when we don't take adequate rest. This indirectly increases your heart rate and your blood pressure. So that what happens to the heart is, once your heart rate increases, your heart has to function more than what is required. So this will generally precipitate a problem of a heart attack. So anything you do, overdo things, it's always not good in life. So better avoid this sort of work stress and increasing in any activity which increases your catecholamine. A catecholamine release will be there during even a normal stress, but that doesn't last long. So that won't create any problem. Like you witness some sort of accident or something, you have a stress, your heart rate increases, then it goes off. It doesn't continue for a longer time. But some stresses will be there which continues for a long time. They are the things which will cause problem. Like your personal stress will be there, which is constant one. That keeps nagging you all the time and you have lack of sleep. Once the sleep is lacked, then again the catecholamine rises, your cortisol level rises, your heart rate increases, your BP increases, and your atherosclerosis starts developing and blockage starts happening. If it is in the coronaries, you have a heart attack, or you can have a stroke if it is in the brain blood vessels. The best simple test I would say is to look into the normal resting pulse rate. Normally you should have a pulse rate of around less than 80. Your pulse rate is normally less than around 80, 60 to 80. It means your heart is not under any stress. This will indirectly, as long as your heart rate is on the lower side, like from 60 to 80, your heart tends to live longer than your resting heart rate around 110 or 120 if it is, because your heart is working more than what is required. So that keep constantly working and then it will burn out easily. Stress-related damage to the heart are of two things. An acute emotional stress is there, what we say is a stress-induced cardiomyopathy. This can happen actually what we see in movies, like suddenly and emotionally some close relative, someone dies, then we immediately cry and then suddenly they fall and they have breathing difficulty. These things normally happens in movies, but actually there's a true thing. This is called as a stress-induced cardiomyopathy. Patient have very fast heart rate and they have giddiness and they fall. Suddenly the heart pumping function, which is normally around 60%, comes down to 20 to 30%. This is a sudden thing which happens, but this is reversible. Because of that acute stress, as I said, that chemical of catecholamine is released. Suddenly your heart rate goes up to 150, 160 during that time of stress. That causes the heart pumping function to go low because of the catecholamine release, and then later, usually it is reversible within a week. This is a type of acute stress cardiomyopathy. This is one type of stress. Next, as I said, usually the chronic stress, which happens like gradually happening over time. You may have some sort of chronic stress in your family or something. There are many issues with even the families or the relatives or something, which you need to take care. But always make sure that you do some sort of physical activity daily, 30 minutes, or some sort of meditation. This will really help you to reduce your stress. The traditional lifestyle diseases is something like the risk factors which causes diabetes, hypertension, smoking, all these things. These are all lifestyle diseases. So which we need to change your lifestyle. Stress is also indirectly a form of lifestyle only, but only thing is you need to follow it regularly. Because diabetes we take medicines, hypertension we take medicines, all this smoking we quit, and alcohol they quit. All these things they easily do it. But stress, something it happens internally. This is in our mind and soul, more of mind and soul management. So that we need to have a control in our mind, which is the most difficult thing to do than compared to taking these medicines and trying to control all the other sort of risk factors. So usually the mind and soul management comes in the last actually. But now for the younger generation, that comes first actually. I would say just spend at least 45 minutes to 1 hour of time for yourself. That's the most important thing you need to take care. You may work for your family, you may work for your daughter, your son. It's most important thing we all come across in our life. It's an earning young generation people, they try to earn, they build the wealth, all those things. Wealth is waste unless you have a proper health. Okay, so you need to take care of your health. The health can be maintained by one, physical activity, at least maybe 30 minutes of physical activity, 15 minutes of even exercises, and 15 minutes of meditation. is more than enough for you to live longer. We doctors in Frontier Lifeline Hospital, we cardiologists actually talk about to the patient regarding the stress management, and we tell them to at least have an exercise regularly done. Even we have a rehabilitation program here, so that we ask them to enroll in this rehabilitation program. Even a patient who undergoes surgery or a stenting, they get little more confident after doing the procedures of any intervention, so that they lead a normal life after the procedure. This gives them a lot of confidence here than usually in other places. The rehabilitation program is starting up now, and here it's already there for the past 4 years now. So really we are having a lot of backup data for this, that they are really doing well after the procedure, and they get the confidence, and really they also bring back the patients to us more.